Many people advise pregnant women to take bed rest the minute they come to know that she is carrying a child. But this is absolutely not necessary. So, which are the conditions which require bed rest during pregnancy and which are the conditions where it should be avoided? This video tries to explain about that. I am Dr. Shobhana Mohandas. I work as a gynecologist and laparoscopic surgeon at Sun Medical Center and Research Center, Thrissur, Kerala. A normal pregnancy without any complications, that woman does not need rest, because if you take rest, even if the patient is conceived after IVF or other infertility treatment, or if she had abortions and this child is a precious child, even in older age, in the marriages at 40s, whichever way, bed rest is not necessary in the first 3 months or later. So, which pregnancies do require bed rest? Anything that causes bleeding, because the food to the baby comes from the placenta or the chorion. Bleeding in pregnancy comes because of blood collection between this placenta or chorion and the uterus. Just like a stamp with gum put on a paper takes some time to stick onto it, this chorion will take some time to stick to the uterus. So you have to give it time. Therefore, after the bleeding stops, you have to wait for 1 week with bed rest to wait for the chorion or the placenta to get back to normal after the clot goes off. So, bleeding in pregnancy is the first indication. I would say the patient requires bed rest. Now, the second reason would be when there is a cervix shortening. Cervix is the opening of the uterus, and generally it is around 3.5 centimeter or above. But if it is less than 2.5, then it is short. Quite often, a stitch is put at the cervix to prevent abortion, but otherwise, some people would advocate progesterone tablets and bed rest. Because if the baby's head comes and sticks on the short mouth of the uterus, there will be preterm labor. So, to avoid that, she may require bed rest. The third reason would be if there are twins, the two babies will have to be carried by the mother, and the uterus is only big enough and strong enough to carry one. So, to take rest is necessary to prevent preterm labor. Now, hypertension or increased blood pressure during pregnancy is very common these days. That is another fourth reason, because at that point, the placenta is the one which causes high pressure in a pregnant woman, unlike in adult onset, non-pregnant people, it is the kidney which causes hypertension. So, placenta is full of blood vessels, and if they are not working properly, if they are brittle, you need to have more and more nutrition going to the placenta, and that's why in hypertension, we ask people to take bed rest. A woman can also bleed when the placenta is lying lower in the uterus. This is dangerous after 27 weeks of pregnancy, because the patient can suddenly lose a lot of blood, and her life and the baby's life can be in danger. This condition is called placenta previa, and this requires absolute bed rest. But quite often, when the placenta is low lying as early as 3 months and 5 months, some practitioners do get scared. Actually speaking, there is no evidence to say that the placenta is low lying in 3 months of pregnancy. When you do an NT scan, it requires bed rest. At 3 months, the placenta can go up. If it is not bleeding, there is no need to take rest, because in later pregnancy, the placenta which is low lying at 3 months of age will definitely go and migrate up to the upper part of the uterus later on. The same thing applies when the scan is done at 5 months pregnancy, when there is an anomaly scan done, detailed scan, and if the placenta is low lying, there is no need to get scared unless there is bleeding. So, if there is no bleeding, just an ultrasound diagnosis of low lying placenta in the early pregnancy does not require bed rest. In later pregnancy, it will require bed rest. So, it is better to be knowledgeable about this fact before lying down right from 3rd month onwards up to 9 months, because that can also cause a lot of mental and physical anxiety. Would be intrauterine growth retardation, or a small baby because of infection or malnutrition or whatever reason, if there is less growth in the baby, taking rest by the mother will help more nutrients to go to the baby. Now, the eighth one would be preterm labor. If the patient is getting irritable uterus earlier on, then to give rest to the uterus and the body will prevent preterm labor. So, in short, unless indicated, bed rest is not necessary in pregnancy. But if there is bleeding or IUGR or short cervix, rest may be needed. As and when the doctor advises you to take bed rest, you have to take it. But panacea of giving bed rest to all pregnant women can do more harm than good, both because of mental pressure to the patient and because of deep vein thrombosis. And it should be avoided in normal pregnancies. Thank you, sir.